Hi everyone. So today is World Contraception Day, and I'm sure you're thinking that's a bit of an inappropriate thing to talk about on a fertility page. But I think it's really important to know about how contraception can affect your fertility. The least invasive one is taking nothing and just timing. So there are a lot of apps out there that you can use to time your cycle, and these are quite effective if you have a regular cycle. So everybody will have some variation from month to month. So it's normal to have variation of a couple of days. So anywhere from sort of 26 days to 35 days is considered a normal cycle. And so you could be off by 3 or 4 days in terms of your fertile window. So there is still a chance that you could conceive if you have a weird period for 1 month. And that can happen when you travel internationally. That can happen if you're ill, you're taking medication, or if you're really, really stressed, you have a death in the family, that kind of thing can affect your cycle. The second method would be barrier contraception. So that's using condoms, and that we all know is effective at preventing STDs as well as conception. But sometimes the condom breaks, sometimes it's expired, sometimes it slips off. So there are instances in which you can conceive whilst using a condom. The next type is the pill. So the pill is made up of estrogen and progesterone. Usually it's a static dose of estrogen and progesterone the whole month, and that prevents ovulation, and it gets your FSH and LH really, really low. So we often find that that doctors will do blood tests when people are on the pill, and they're like, oh my gosh, your FSH and LH are really, really low. And we're like, yep, that's what the pill does. It's working. So yeah, it works really, really well to prevent you from conceiving by preventing ovulation. And what we really like about the pill is that it's a really good spacer between pregnancies, because as soon as you stop it, you should have resumption of your normal menses thereafter. In particular, it's a really good option for patients who have polycystic ovarian syndrome, because PCOS is a chronic condition where your LH is abnormally high. So if you're taking estrogen and progesterone that is lowering your LH, then your chance of natural conception will be the highest soon after stopping that contraceptive pill, because your LH will be nice and low. The longer you're off the pill, the higher that LH will go, and the less likely you'll be to ovulate naturally on your own. So the pill is a really nice spacer between pregnancies, because you get immediate return to fertility when you stop it.